So welcome to the Cancer Prevention and Wellness Series. We're going to let a few more people join us and we'll get started in a couple minutes. Welcome to the Cancer Prevention and Wellness Series. This is a monthly series that emphasizes cancer prevention, lifestyle techniques, wellness techniques. We have a really important speaker tonight. I'm Jeff Jagir, I'm your host, and this is produced by the Cancer Survivors Park Alliance in Greenville. Before we get started, just a few housekeeping things. When you entered for the lecture, you were muted. That does not mean we don't want to hear from you. There will be some questions that will be generated by our speaker, and we would like you to type those into the chat box, and we'll be monitoring those. The other thing is that this session will be recorded in about 24 to 36 hours. It will be placed on the Cancer Survivors Park website, which is Cancer Survivors Park, all one word, .org. So that's a place where if you enjoy these remarks and feel that they're important, not only to yourself, but to family members and your children and whatnot, make sure you disseminate the information and let them know how to get to the recording of this lecture. So without further ado, I'm going to introduce Dr. Heather Brandt. Dr. Brandt is the director of the HPV Cancer Prevention Program at St. Jude's Children's Regional Hospital. She's the co-director of outreach in the St. Jude's Comprehensive Cancer Center. She's originally from Iowa, made a huge move some 24 years ago to come to Columbia and work and get her master's and doctorate at the USC Arnold School of Public Health, where she has been a professor and I guess still has a joint appointment along with the University of Memphis. So she has started a program at St. Jude's, which I think needs no introduction, but is disseminating it throughout the Southeast, where it probably best needs to be disseminated, about the human papillomavirus and what it can do and what we can do about it. So without further ado, Dr. Brandt, thanks so much for joining us and for sharing your expertise and remarks.
Thank you, Dr. Jaguar, and also thank you to Laura Coleman Nichols and everyone who has been so accommodating and wonderful to get to this point. And I'm excited to have the chance today to talk with you about HPV cancer prevention. And we know people carry a lot of titles: mom, dad, grandma, papa, aunt, uncle, and we really want to help people understand how they can influence and keep their loved ones safe by helping them receive HPV vaccination if in the recommended age range. So through my efforts at St. Jude in our program, we encourage and educate our patients and their families and the broader community about HPV cancer prevention. So today, I'm going to provide you with information about HPV and specifically about HPV vaccination as a cancer prevention strategy. We don't have a way to prevent the pediatric cancers that afflict most of our patients at St. Jude Children's Research Hospital, but we can prevent HPV cancers among all children so that they don't develop these cancers as adults. And so I'm going to provide a brief overview of HPV, and then we'll talk a little bit more about our program and also have the chance to point you in the direction of some really wonderful work that's happening in South Carolina. And I have no disclosures to share with you. So here are the questions and answers that I'm going to run through. And I hope if you have questions, any question, that you will put them in the chat for me to address as well. We know people have a lot of questions about this topic, and it's one for which, unfortunately, there's been a lot of misinformation that's circulated. So let's get down to the facts about HPV. So first, what is HPV? Well, HPV is a group of over 150 viruses. More than 40 types of HPV can affect the external and internal genital organs in everyone, that's men and women, as well as in the throat and the mouth. And of the 40 types that infect these anogenital areas, as they're referred to, and the mouth and throat, there are high risk or oncogenic cancer-causing types and low risk or non-oncogenic types. The low risk types are linked to genital warts and recurrent respiratory papillomatosis, or RRP. The high risk types are the ones that are linked to cancer. So HPV infections are so common that nearly all men and women in the United States will get HPV at some point in their lives. And if you've seen any of the recent commercials from Merck, the maker of Gardasil 9 vaccination, you know that many people who get the HPV virus clear it, meaning they get it, it stays in them for a little while and goes away and doesn't cause any problems. That's not the case for several 100,000 people each year in the United States. Nearly 80 million Americans are currently infected with HPV, and about 14 million Americans, including teens, become infected each year as well. So HPV is transmitted through intimate skin-to-skin contact, and it's the most common sexually transmitted infection. You can get HPV by having vaginal, anal, or oral sex with someone who has the virus, and anyone who is sexually active can get HPV, even if you've had sex with only one person. HPV is so common that nearly all sexually active men and women get it at some point in their lives. And it can be passed when people have no signs or symptoms. And you can develop symptoms many years after you may be exposed, making it hard to know when you first became infected. So each year in the United States, HPV is estimated to cause nearly 37,000 cases of cancer. In addition to those cases of cancer, there are more than 200,000 cases of precancers of the cervix, more than 500,000 cases of genital warts, and more than 1,000 cases of pediatric recurrent respiratory papillomatosis. And that adds up to a lot of people being affected by HPV. And the vast majority of these conditions are preventable through HPV vaccination. There's just no way to know in whom HPV will lead to health problems like cancer, precancer, genital warts. People who have weakened immune systems may be less likely to be able to fight off HPV infections and more likely to develop these health problems. This includes people who are living with HIV and our very own cancer survivor population. Cancer survivors are at very high risk of acquiring a second or even third cancer later in life as a result of HPV. And cancer can take a really long time to develop after someone gets HPV. Most infections, about 9 out of 10, do go away by themselves in just a couple of years, but sometimes HPV infections last longer, as evidenced by those big numbers I shared: 37,000 cases of HPV cancers, 200,000 cases of HPV precancers of the cervix, 500,000 cases of genital warts, and more than 1,000 cases of pediatric RRP. And so in those cases, we know that vaccination offers us protection against 90% of those precancers and cancers, and almost 100% of those genital warts and RRP cases. So
So
a
Dr.
lot of
Brandt,
times,
the 36,000 incidents, what does that translate to as far as mortality?
sure. So it depends on the type of cancer, because each type of cancer has a different survival
Right.
prognosis. So, for example, with cervical cancer, we see about 12,000 women each year diagnosed with cervical cancer, and about 25 to 30% of those women will die.
Okay.
So that's about a 1 out of 3, 1 out of 4 chance. For other types of cancers for which there aren't regular screening tests available, you will see very different rates. So vulvar, vaginal, and penile cancers are
Right.
extraordinarily rare, and
Right.
they may be likely to be detected at more advanced stages. And so
Because we
we
don't have
see
the pap smear and whatnot. Right.
Correct. And so we see differences in survival. For anal rectal cancers, those that are linked to squamous cell types of cancers, squamous cells are one of the types of solid tumor cancers that affect humans. And these squamous cells in the anus and rectum tend to be a small percent of those cancers, but very aggressive and virulent. And so you see a different survival prognosis for that group. And then, interestingly enough, for oropharyngeal cancers that are linked to HPV, and those include those that are at the base of the throat and, the base of the tongue and tonsil area in the oral cavity, those actually seem to have fairly good prognosis if caught in localized stages. Any cancers that are going to be detected at more distant stages are going to have lower survival rates and worse prognosis. Yes.
Thank you.
So another question I get asked a lot is, how do I know if I have HPV? And the easiest answer to say is, you probably won't, unless you're a woman who is recommended for a pap test, which is the cervical cancer screening test, at a time when you have the infection. You may not know unless you develop a case of genital warts where the warts are visible in the external areas of the genitalia. You may not know if you have HPV because there are no recommended screening tests for detecting HPV outside of cancer screening, and specifically cervical cancer screening. There are visual exams that can be done for vaginal and vulvar cancers and penile cancers as well. And for anal cancer, in some high risk populations, such as people who are living with HIV, anal pap tests may be recommended as a preventive strategy to try to identify HPV cancers in that area. How can HPV be prevented? Well, I think you've already heard me say a couple of times that we're very fortunate to have a safe and effective vaccination that is given to children to protect them before they're ever exposed to HPV so that they do not develop any of these HPV diseases and specifically HPV cancers. So HPV vaccination is routinely recommended at ages 11 and 12 and can be started at age 9. And we, through the St. Jude program, along with the American Cancer Society and American Academy of Pediatrics, recommend HPV vaccination between the ages of 9 and 12 and by the 13th birthday. And for HPV vaccination to be most effective, we want to make sure that it's given to children before they would be exposed to the virus. And cancer takes a long time to develop, as I shared. There's no way to know in whom it's going to cause a problem and in whom it's not. But we know that in the United States, about 59% of adolescents have completed the HPV vaccination series, and that falls well short of the 80% goal nationally. And this vaccination is no longer the new kid on the block. This vaccination has been around for 16 years and routinely recommended for that entire period. So we absolutely have the chance to ensure that our children today are fully protected from HPV cancers when they're older. So let me talk just a little bit about some more reasons why we want people to get vaccinated, and in particular, 9 to 12-year-olds before their 13th birthday. We have such an incredible opportunity to prevent HPV cancers. Our vision is a world free of HPV cancers. And that's actually a possibility. In countries like Australia, they're on track to eliminate cervical cancer by the year 2030. So that means in the next 10 years, they will have no cases of cervical cancer because of the high uptake of HPV vaccination. So HPV vaccinations, again, are so common. 85% of people are going to get an HPV infection in their lifetime. And this safe and effective vaccination can be given to help prevent those from ever happening. HPV vaccination works. It prevents cancers. The evidence continues to mount and show that HPV vaccination in some countries has been shown to be 98% effective against precancers and more than 90% effective against HPV cancers. In the United States, even with relatively low uptake that varies greatly by geographic region and among populations, we still have seen a fall off of 86% of HPV infections among teenage girls. So just imagine if we were able to get even more people vaccinated, how we might be able to prevent additional cancers, precancers, and other diseases. As I shared, HPV can prevent over 90% of these cancers. That's about the average attendance at a baseball game of 37,000 people. We can prevent 90% of those. So just think about an entire baseball stadium full of people. We can prevent that many cancers each year if we are able to increase HPV vaccination among this population. Doctors routinely screen for cervical cancer, but there are no recommended cancer screening tests to detect these other 5 cancers that are caused by HPV. And these other types of HPV cancer may not be detected until they cause health problems. So HPV cancer vaccination can prevent these cancers from ever developing. We've had a parent panel who's been part of the St. Jude HPV Cancer Prevention Program. And one of our parents said, "Aren't we lucky as parents that we have this tool available to us to make a decision to protect our kids today? There's not a lot of things we can protect our kids against, but this is one that we can protect them against and keep them safe as adults." Most children only are going to need 2 doses of HPV vaccine when it's given before the age of 15. You can take advantage of any visit to a child's doctor to get these recommended vaccines, including sports physicals, annual checkups, even sick visits. And HPV vaccination is safe to give with other vaccinations like an annual flu shot, like a whooping cough vaccine, meningitis vaccine, and even COVID-19 vaccines.
And Dr. Brandt, the series of two, what's the interval between the first and second dose optimally?
Sure. For 2 doses, we're going to want to give the first dose and then the second dose 6 to 12 months later.
Okay.
So there's a wide range for a reason. It's designed to be have the high levels of a robust immune response, or immunogenicity as it's called. But we also recognize that parents and caregivers are busy people. And so if they bring a child back anywhere in that window, they can get their second dose and be protected. For those who need 3 doses, it's usually at the first dose and then 2 months and then 6 months to a year later as well.
And the ones that need more dosing are the older?
They're the older, and there's also for people who are living with HIV, or have otherwise very weakened immune systems from immune suppression or immunocompromised condition. They're going to need 3 doses. There's a lot of discussion among St. Jude clinicians, and there's research being done. We also think that childhood cancer survivors may need 3 doses as well, because childhood cancer patients undergo really intense therapies that have long-term effects on their immune system. And so just to make sure they're protected because they are at such higher risk, it's also recommended in some cases that they get 3 doses too.
Good. Thank you.
So HPV vaccination, it's safe, it works, and it provides long-lasting protection. We've had more than 300 million doses of HPV vaccination distributed, and it has a very reassuring safety record that's backed by more than 16 years of monitoring and research. Like any vaccine or medicine, there are some side effects that are important to acknowledge. In some cases, these side effects tell us that your immune system is working to help protect you from this condition. These include pain and redness, or even swelling in the arm where the shot was given. Dizziness or fainting. This is why after getting the HPV vaccine, they ask for children to, or anyone who's receiving it, children or adults, to wait for 15 minutes just to make sure that there's no dizziness or fainting. And it's potentially possible that someone could feel nauseous or have a headache as well. Fainting after any vaccination, by the way, is more common among adolescents. And so that's why there's the 15-minute wait after that. But the benefits of HPV vaccination certainly outweigh these potential short-term side effects that are sometimes identified. So let me talk a little bit about the opportunity for impact. I think these are important factors to consider. So most of these cancers caused by HPV are almost entirely preventable. And good news, we have a safe, effective, and long-lasting vaccination that's going to help to prevent them. I really like this infographic from the Centers for Disease Control and Prevention, or from the CDC. It really shows you how cervical cancer is just the tip of the iceberg. There's all of these other HPV-associated diseases that add up. And this is how HPV vaccination becomes a very important cancer prevention tool. I think about the opportunity for us to prevent 90% of these cases of cancer, precancers, and other diseases. And that's a huge prevention potential for us, so that many people who are developing these cancers are people who are raising families. These cancers tend to be diagnosed at younger ages in comparison to other cancers. Cancer is a disease of aging. It's why you see so many of the screening guidelines start as people get older or entering into the middle of their lives. These cancers tend to affect younger people, and it's opportunity to prevent those from taking a young mother, a young father, from taking someone who's raising a family. And everybody's life matters, of course, and is important. But with these types of cancers, we do have that prevention tool available to us. I always like to show a few data slides. I don't want to overwhelm anyone with too much data, but the most recently available data for HPV cancers in the United States are from 2018. And I've included some selected mid-southern and southern states to give you some exact rates for these types of cancers, these states have consistently had higher incidence of HPV cancers compared to the rest of the United States. St. Jude is based in Memphis, Tennessee. We have affiliate locations in 8 other cities in the United States, most of those in the southern part of the country and Southeast. And Arkansas, Tennessee, and Louisiana are 3 of the top 5 states for HPV cancers. And these are states in which we're doing work currently. I also want to show you about vaccination. So the vaccination data are most current for 2020. These are among 13 to 17-year-olds. Again, I've included some of the same states. You can see that South Carolina has been doing relatively well in comparison to other southern states, but still falls below the average for the United States. So in 2020, compared to 2019, we saw some overall increases in the first dose rate of HPV and also the up-to-date rate of HPV, but we still fall short of that 80% national goal that we're trying to achieve. So I use this map a lot to show that the areas in this circle, these are the areas where St. Jude has affiliate facilities. And of course, Memphis is included in there as well, and South Carolina. When we take a look at HPV vaccination coverage and then these incidence rates, we can see that there's just a major opportunity to be able to improve HPV vaccination coverage and prevent these HPV cancers. Rural areas have much lower coverage for HPV vaccination. Prior to the pandemic, children who were publicly insured were actually more likely to have 1 dose of HPV vaccination compared to commercially or privately insured children. That's no longer the case. The pandemic has completely erased those gains that had been achieved prior. So let's talk a little bit about what can we do to increase HPV vaccination coverage. And fortunately, there are many things we know that work well to increase HPV vaccination and to address concerns of parents and caregivers who make primary decisions about vaccination for their children. So the first way I want to share with you is a strong provider recommendation in a supportive system continues to be the most significant predictor of HPV vaccination coverage. So this approach I'm going to share with you here is from Dr. Noel Brewer and Dr. Melissa Gilkey, who are at the University of North Carolina in Chapel Hill. They offer a very simplistic way of a presumptive approach or announcement approach. So first, note the child's age. Second, announce that the child is due for vaccines that prevent these diseases. And third, indicate the vaccination will be given today. So here's what that looks like. Now that Abigail is 11, she's due for 3 vaccines to protect her against meningitis, HPV cancers, and pertussis. We'll give them at the end of the visit. This simplistic announcement approach statement has been shown to be up to 10 times more effective than any other type of announcement. This is because many parents and caregivers who are making vaccination decisions experience vaccination hesitancy. Vaccination hesitancy has been heightened as a result of the COVID-19 pandemic, and there's likely some conflation that's occurred with other routinely recommended vaccinations. So vaccine acceptance occurs on a continuum of levels of confidence and acceptance. Refusing every vaccine is on one end. And just to let you know, in the United States, 98% of children are up to date with all recommended vaccinations by kindergarten.
That's good. That's
So
incredible.
there are very few people who actually fall into this refusing all vaccines. I bet that's something that may surprise some of you because we hear so much about anti-vaccination or opposed to vaccination. In reality, it's very normal. Most everyone, 98% of kids, are fully vaccinated by kindergarten. And then all the way over to accepting all vaccines on time. And I want to acknowledge my own hesitancy. Until about 10 years ago, I never got the flu shot. And the flu shot is recommended. for me, and I didn't get the flu shot. So I also would have fallen somewhere on this continuum of vaccination hesitancy because I was not getting all vaccines on time. I now am squarely into that circle of accepting all vaccines on time. So there's a real need to build confidence in vaccinations. And that format of a provider recommendation serves to do just that, to build confidence in the vaccine. A provider is a trusted source of information for parents and caregivers who want their children to be healthy and want them to lead long, successful, healthy lives. And so having a provider deliver that type of message can help provide that confidence. Now, with that comes some of this reluctance or hesitancy and some usual questions. These are things we want parents and caregivers to ask of their healthcare providers. Is this safe? Why do they need it so young? Are you sure this is a vaccine that we should be giving to my child? These are all usual questions. And this approach, this announcement presumptive approach, provides a way to answer those questions and address concerns of parents as well.
So do you have some go-to conversations, some words that perhaps can take somebody from the left side of the spectrum over a little bit closer to the median?
So I'm not sure if it's exactly words, but it's a process.
Yeah.
Vaccination hesitancy occurs over time, and getting someone to feel confident in vaccinations can also take time. It's one of the reasons why we recommend starting those conversations at age 9, so that it may take some time to instill confidence and make sure that parents and caregivers are comfortable with the information that they have. And so that way we can get as many kids as possible protected in that 9 to 12-year-old age range, or by their 13th birthday, have the series completed. And the evidence that exists for vaccination hesitancy shows that testimonials from parents who were once hesitant and made a decision then to vaccinate can be very useful. We also know that testimonials from survivors can be very powerful, instructive tools about what can ultimately be prevented. No one wants to think about their 9-year-old engaging in activities that may result in them acquiring an HPV infection. They also don't want to think about their 9-year-old as a 40-year-old with a preventive cervical cancer. So it has to be proximal and as close as it can to the decision making. Concerns from parents tend to stem around things like safety, and this vaccination has a stellar safety record. It stacks up really well compared to other types of vaccinations recommended for kids. In fact, exceeds many of the safety profiles for many of those vaccinations. It also works really well. Not only do we know that it works to prevent precancers and genital warts, the evidence is in that it also prevents actual cases of cancers after the 16 years that it's been available. We also know that some parents, unfortunately, have some false beliefs that if they provide this vaccination to their child, that their child may then become sexually active as a result of thinking that they're protected. That just hasn't held up in research studies. This so-called behavioral disinhibition is the same mindset that years ago was if you provide women with pain relief or analgesic relief during childbirth, that they'll want to continue to just have babies. It's that kind of mindset. It's if you provide clean needles to people who are using intravenously injected drugs, that they'll use more drugs, when actually it shows that providing pain relief for women who are delivering babies actually has zero impact on their decision to have future babies. And for those who are using intravenous drug injections, those folks actually use fewer drugs when you give them clean needles. So there's a lot of evidence over the period of years that have been done and that has been done in this space. And there's been no correlation between giving this vaccine and any changes to the sexual activity of teens. Well, let me move now to some of the other things that we know work. Things that we know work include addressing supply and demand challenges. And so We know that parents may need to build their confidence, parents and caregivers may need to build their confidence. And so there are many community groups like this one that has a chance to have somebody hear what I'm saying today, share it with somebody else, and share accurate information about HPV vaccination as cancer prevention. That can get done through a range of nonprofit organizations and community organizations. In South Carolina, there's the South Carolina Cancer Alliance, which
Right.
has a working group focused on HPV cancer prevention. And there's also an immunization coalition focused on adolescent vaccinations. These are both very motivated groups in the state of South Carolina doing really great work linking information about HPV vaccination with access points to be able to then get vaccinated. And that's where the clinical side comes in. They're able to offer the supply. So if we can build demand, they then can offer a supply. And these community clinical linkages can work together and serve to reinforce and build confidence in vaccinations. We also know that our consumerism, coupled with the influences of the pandemic, has really resulted in changes to how we access healthcare and how we want to access healthcare. So this includes how we're going to be able to improve access to HPV vaccination outside of a traditional medical office. Shared and collaborative models are likely the future. And so we have to think about schools. We have to think about pharmacies, which have become main vaccinators during the COVID-19 pandemic. Oral health providers. There has never been a health profession that has done better with reminder and recall than oral health providers. If you see a dentist regularly, you know you probably see that dentist twice a year or every 6 months because they are calling you back in. Those are touch points where they can mention the connection between HPV and oral cancers during their American Dental Association recommended oral pharyngeal, oral cavity physical exam. They also can mention that HPV vaccination is recommended. And then Dr. Marvella Ford, who's at Hollings Cancer Center in Charleston, South Carolina, has a mobile unit that offers HPV vaccination. About a week before the mobile unit comes, they do educational sessions, and then they bring the mobile unit so that people can actually then access HPV vaccination. So we have to think creatively about how do we create these different access points for HPV vaccination. So let me just finish up with a little bit of information about our program, and then I look forward to answering your questions. So some background on the work that we're doing. Our program started in July 2020 when I began as the director and formally launched on March 4th, 2021 on International HPV Awareness Day last year. Our program's vision, as I shared earlier, is founded on this principle of HPV vaccination as cancer prevention. And we really do believe a world free of HPV cancers is possible with effective awareness and knowledge building activities, vaccination in particular, timely screening, and timely treatment as well. We have a growing team of talented, committed professionals who are focused on improving HPV vaccination coverage. We'll be bringing on additional team members starting in the next fiscal year in July. It's an exciting time to be part of our program and to join us for these efforts. We've approached our work locally, statewide, regionally, and nationally as well. We do have some national campaigns. I'll share a little bit about that in just a moment. We've convened a local roundtable in Memphis and Shelby County in Tennessee. We also work across these other southern and southeastern states, with the exception of Louisiana, have the lowest HPV vaccination coverage in the United States. So let me talk a little bit about these different areas of clinical, community, policy, equity, and partnerships, all of which serve as the foundation of our program's activities. And one of our activities right now is gathering information on research priorities. Our program's not technically a research program. It's really focused on pragmatic implementation of evidence-based interventions, but there's a lot to be learned from that. And so we've been working with Washington University in St. Louis on a research collaborative, and we are working to identify key research priorities that we're interested in understanding. And so if you're interested in participating, you can use the Vanity URL that's shown there, or you can scan with your mobile phone the QR code that's shown on this slide. And this survey will be open. It says here until May 15th. We just made the decision to keep it open until May 22nd. We also have developed state profiles. These are designed to offer our state partners a quick overview of HPV cancers and HPV vaccination data. These are available on our program website as well. And we have a range of different educational materials available in English and Spanish and for 4 different populations. And we recognize that in our attention to equity and inclusivity, the images that are used vary. So if you go click on these, you can click on different image examples for each of these different types of educational materials. We've done a lot of work in the policy space. We've done a deep dive into policies across 4 states. We're currently completing a comprehensive analysis of all publicly available HPV data and also for purchase commercial and privately available claims data to be able to make recommendations on a policy front. We know there is a relationship between states that have not expanded Medicaid and states that have, that there's an interest in trying to explore how that could be a useful tool. We see in states that have expanded Medicaid, they have much higher uptake. Right now in the United States, 3 states plus Puerto Rico and the District of Columbia require HPV vaccination. They also have much higher rates. Rhode Island is the one that many people point to as well. So these are there's a lot of opportunity in the policy space as well. And lastly, to finish up, I want to tell you a little bit about our campaign, Path to a Bright Future. HPV vaccination is cancer prevention, and Path to a Bright Future is our program's new public awareness, education, and advocacy campaign to generate urgency for on-time HPV vaccination for adolescents. Our campaign leverages the latest in public health findings to clearly articulate the dangers of HPV precancers and cancers, in addition to focusing on the benefits of HPV vaccination. We've conducted all types of formative research with parents and caregivers who are making vaccination decisions to inform what the campaign looks like. You can access all of the campaign materials at stjude.org/bright-future. You can also get there from stjude.org/HPV. We have a range of different resources that are available online. And we also have a parent pledge that launched on Mother's Day. We know many times in families, mothers serve as the main vaccination decision makers. And so we launched a parent pledge, and we have parent education materials and a range of other resources as well. So lastly, in closing, before I'm happy to take your questions, HPV vaccination has a reassuring safety record that's been backed by more than 16 years of monitoring and research. Data have shown that HPV vaccination prevents precancers and also actual cases of cancers. So not only is it safe, it also works really well, and it provides long-lasting protection against HPV cancers. Here's my contact information if you're interested in reaching out. And I think we do have some questions in the chat that I'm happy to address. Just let me know if you want me to start working my way through those.
I think that's fine. Obviously, we talked a little bit before we got on about the fact that this is available to older patients as well. what does that look like? If somebody's a teenager, should they be evaluated to see if they're already infected before a vaccine, or would the vaccine still be appropriate? So I think for the people that are listening in, they're interested in obviously vaccinating the appropriate, younger population. That's probably where we're going to have the biggest bang for our buck. But what about the olders?
Sure. So HPV vaccination is routinely recommended for age 9 through 26-year-olds. So that means that the CDC says everyone between ages 9 and 26 can get this vaccination. The 9 to 12-year-old focus is because there is a clinical quality measure by the 13th birthday. And recent data have shown that if we're able to protect kids at that 9 to 12-year-old age, that they have a very strong immune response and it lasts a very long time. So if somebody waits until age 17, for example, to get vaccinated, the effectiveness wanes. And for 9 to 12-year-olds, it's the highest level of effectiveness. The National HPV Vaccination Roundtable recently released a new summary statement about the importance of the 9 to 12-year-old age group getting vaccinated. And it summarizes everything we know. And those are just a few of the highlights. For those not in that 9 to 12-year-old age range, there still is potential benefit. As I mentioned, the CDC does routinely recommend HPV vaccination through age 26. It is a preventive vaccine, so it is going to work when someone has not been exposed to one or more of the 9 types of HPV that are included in Gardasil 9, which is the only HPV vaccination available in the United States currently. For those aged 27 to 45, some people may benefit. And so the CDC recommends talking with a healthcare provider to see if those aged 27 to 45 may potentially benefit. So our focus in the St. Jude program is really on the 9 to 12-year-olds. We
Right.
feel the evidence supports that as the primary focus for this vaccination, for their immune response and the long-term effectiveness of the vaccine. And if you get the vaccine before age 15, it's 2 doses. So there's a couple of different cut points here that I know can get really confusing. So it's 2 doses for 9 to 12, and we focus a lot on that as well, that it's only 2 doses instead of 3 at those younger age groups.
And as far as the vaccine, is this a live attenuated, or is this all just mRNA, DNA? What?
Yeah, so HPV, there are 4 different types of vaccinations that are vaccination categories, and
Yeah.
HPV vaccination is a protein subunit type of vaccine. This type of vaccine is also the same as hepatitis B vaccine. Those are both protein subunit. What that means is that there is a virus-like particle, or VLP, which is an outer shell of the virus, a mimic or a copycat, that is then introduced into the body. And so there's nothing inside of it. There's no risk of getting the disease from the vaccine. It's a hollowed out outer shell, like a mimic or a copycat. And that's injected into someone, and our body attacks that. Our immune system attacks that and develops antibodies or protections against that virus, so that if it ever comes around, which of course we hope it doesn't, but if it does, our bodies will recognize that and say, oh, I've seen you before and you're not welcomed here. And so that's the type of vaccine that the HPV vaccine is. It's a protein subunit or a virus-like particle, or VLP vaccine.
So in the setting of somebody that perhaps has a little vaccine hesitancy, is there an option of preventing it via, quote, safe sex and use of a condom and that sort of thing?
Sure. So I may be behind the times, but I haven't seen full body condoms yet for people.
Right.
And so if there is such a thing as a full body condom that somebody could wear, then yes.
Right.
certainly through use. Now, of course, I recommend using condoms if somebody is engaging in sexual activity for prevention of a range of other conditions, including other sexually transmitted infections, unintended pregnancy, and more. But HPV can live in the entire genital area. And so condoms don't cover the entire genital area. And so, in that regard, sure, condoms can reduce transmission, but they're not going to entirely eliminate it. The other thing we'll hear sometimes is about abstinence, and abstinence means something different to everyone. For some people, there's a continuum, and for some people, abstinence means no touching, kissing, any type of interaction at all. That's what's meant by abstinent. And if that is your definition of abstinence, that there is none of that happening, no kissing, no touching, no contact with another person, then yes, abstinence may certainly result in not acquiring an HPV infection. The fact is that it's a normal part of human growth and development to want to engage with other humans, whether that be through hand holding, touching, kissing, or other intimate activities. And all of those pose certain risks for transmission of HPV. So I think these are highly variable definitions, and we don't have enough time today to dig into all of those. But sure, there's some reduction of risk, but it's not going to provide the same reduction that the vaccination provides.
So, in your experience of overcoming the barriers, right now, if a child is under their parents' insurance policy, you would say that all insurance policies are covering this now?
Sure. So for children who are 18 and younger, all major health insurances cover vaccinations fully. And for children who are underinsured or uninsured, there is a federal Vaccines for Children program that provides at no cost all recommended vaccinations, all routinely recommended vaccinations. And in a state like South Carolina, there are some children who don't qualify for the Vaccines for Children program, but have inadequate insurance. So they're characterized as underinsured.
Right.
And in 2016, then Governor Nikki Haley approved the Cervical Cancer Prevention Act in South Carolina, which allowed for those children, about 3,000 to 4,000 children every year, to be able to access HPV vaccination at no charge to them. So in general, HPV vaccination is widely covered for 18 and younger. It's over age 18 where there's greater variability. South Carolina, like Tennessee, is a state that has not expanded Medicaid. And so there's variability in preventive coverage for health insurance, commercial health insurance. And so in many instances, those who are 19 to 45 may have no coverage for HPV vaccination. It's another reason why it's important to focus on the younger children, especially the 9 to 12-year-olds, where we know it works best and it's the ideal age for them as well.
And I know we're running short on time, but the logistics of getting to the governmental path of getting a free vaccine for somebody who's on or underinsured, is there a special unit at DHEC or?
No, there are more than 500 VFC providers in the state of South Carolina. And in fact, most major pediatricians' offices are part of the Vaccines for Children's program.
Gotcha.
And so there should be no interruption in your usual source of care. If federally qualified health centers, rural health centers, all of these are Vaccines for Children program providers, in addition to the health department. And so the best recommendation would be to ask your child's healthcare provider for more information. And if you're interested in asking specifically for your own commercial or privately coverages, call the 1-800 number on the back of your insurance card to ask and confirm. So those are the best ways. But one of the great things about vaccinations in the United States is that it's one of the 10 greatest public health achievements. Children used to die routinely from many of these vaccine preventable diseases. And we can add these HPV cancers to that list, that as adults, they no longer need to die from these cancers. And so in this case, we have widespread access to these vaccinations, especially for children. Again, it's the adults where it gets more complicated in terms of coverage. St. Jude does offer full coverage for HPV vaccination for anyone between the age of 9 and 45. It's something that they're very committed to, and we know some other insurers have similarly done the same.
Well, I can tell you, we've been doing this for 2.5, 3 years now, and probably as far as impact, this has been our most impactful presentation. So we have a listserv via the Cancer Survivors Park, and I know, Jenny, you have a listserv as well that can send us out, but we just want to make sure that this is something that people can get access to, this presentation, because it needs to be information that's disseminated. And the more people that are perhaps not seeing a pediatrician, I mean, the more rural and the health inequity issue where they're not seeing their doctor, that, you know, to have capabilities of getting that free vaccine and getting the information, the correct information, and not the misinformation, is very important to that. So we just have to make sure that we get the word out for what has been, you know, a wonderful presentation with really, really good information. And you picked a great profession to be into as far as making a really big difference. I mean, we talk about genetics and genetic syndromes and educating people. This is not a genetic syndrome. This is but it's something that we have got access to a close to 100% prevention capability if we can just get it to people. So I very much appreciate your remarks and thank you for your time and putting this together, and hopefully we can disseminate it and make South Carolina something you're proud of again.
I'm always proud of South Carolina. And I want to just say, for anyone who's interested in this issue, the South Carolina Cancer Alliance and the Adolescent Immunization Task Force in South Carolina, they are doing really great work. My colleagues, Dr. Sayward Harrison at the University of South Carolina, Dr. Beth Sundstrom, who's at the College of Charleston, Dr. Kathleen Cartmel, who's at Clemson University, and we have other colleagues at other institutions across the state as well, including Francis Marion and others. I hope that you'll reach out to them or reach out to me, and I'd be more than happy to connect you to them. They're always looking for people who are supportive of these efforts to help make sure that more kids are able to be protected against HPV cancers as adults.
Well, some people wonder about whether or not their profession's making a difference. You don't have to question that at all. So
thank you.
Thank you for your remarks. We will have our next session on June 9th, which is the second Thursday in June. And that will be Dr. Robert Siegel, who's the director of the cancer services at Bon Secours St. Francis in Greenville. And kind of apropos to the presentation here, we're going to talk about cancer care and treatments, including misinformation and misunderstanding. So hopefully you can put that on your calendar as something that is must-see TV. And we, as always, we usually finish with a quote, and this is a quote from a Nobel Prize winning philosopher, and it's a very quick thing. So I'll read it twice. Education is not filling of a pail, but the lighting of a fire. Education is not filling of a pail, but the lighting of a fire. So I hope everybody has a great evening. Again, thank you, Dr. Brandt, for your great remarks and wonderful information. And we'll try to disseminate this to our whole listserv and make sure that your remarks reach the greatest number of people.
Thank you so much for having me.
Good night.